I was also wondering if you could talk about the Coldiron Fellowship, which if you could explain more about what it is, but how the Coldiron Fellowship helped you to become a leader. And I was wondering what else did it teach you?
Absolutely. So when I started my doctorate in nursing practice way back in 2012, I know that the pathway that I was following through is to be a leader. And I was just so lucky that through Dr. Joyce Fitzpatrick, I was able to be exposed on the international global health. My preceptor at the time when I went to Case Western was Dr. Judith Shamian. She was the president of the International Council of Nurses. And I worked with her in trying to just understand how can we partner with the World Bank in terms of understanding the issues that we have, particularly in rural health, and how can we utilize the skills and expertise of nurses in areas that are underrepresented. So I did a lot of research and recommendations, and she was able to utilize that presentation to work with the World Bank. And I think up to now, they're doing that, right? And I think the type of mentorship and also preceptorship helped me to really see a bigger picture in terms of building relationships, building networks with other organizations and also individuals, because there are so many things that we can accomplish as nurses, right? But it's really the right connection that would really help us achieve these goals. And I think it resonates well with me because when I did my research, my interest was really in global health and how we can utilize technology, trying to marry my skill sets as a nursing informatics. So I did my research in the Philippines. I know that mobile health is working. I know that the utilization of text messaging will expand more than how we were using it. But at the same time, there is lack of adequate literature, especially in the Philippine side, on how can we utilize it. Here in the United States, there has been studies in terms of like text for immunization. So that's where I based my research at the time. And I think now that we have seen with the pandemic that people can easily adopt technology, and it really made those barriers more accessible because of the use of technology. We experienced that. So I think that's where my passion is, and that's what motivated me to further my education enrolling in Coldiron. I know that I will be able to learn more with other leaders that are leading healthcare systems, and that's very important from a organizational perspective, because PNAA structure is really positioned to be representative of Filipino Americans and also internationally educated nurses, right? From a migration perspective. And I know that our contributions might be underrepresented, but there's so many of us. Just like Ren here, everyone is so appreciative and admire his knowledge and his passion in really understanding oral history and the impact of colonization, right? And how we practice nursing on the Philippine side, and how we bring that Western culture on how we take care of our patients. So I think there's so much learning that we could do, but at the same time, I really wanted to highlight the contributions of Filipino American nurses, not only here in the United States, but also globally.